welcome villagers and welcome to The Village Who. This is our new program to introduce the company to many of its current leaders and help them understand what motivates them, what type of work they do, and their passions not only with Village, but also in life. Listen in and have a great day. Good morning, the great Dr. Irizarry. How are you?
I'm doing great.
Good to see you. Good to see you. So you are a primary care physician. Why did you choose that as the profession you wanted to be in? Of anything you could be, what made you choose primary medicine first and then primary care as a subspecialty?
It's about service. That feeling of sharing that blessing with others, to show mercy, to give hope to people, especially in difficult circumstances where even though something could be very hard, patients have hope and can face the situation with honor and grace. We have to be very serious and committed to bring that medical service, and then, only then, we can use our set of skills as clinicians to help the patients. That's what brought me to medicine, the commitment to serve and be caring for patients. What else can I ask for? And it's an honor when patients come to us and they're grateful for the service that we do. We want to know them. We want them to come. We want to coordinate all their acute, chronic, and preventive care. It's about knowing them, because you know what? They teach me to be a better person, be a better provider, and in a way I tell them, you're my medicine. And
I love that. That's a great thing. So you told me something a little bit ago when we were outside talking. You talked to me a little bit about your mom. For the audience to get to know you a little bit, maybe talk a little bit about Puerto Rico and what happened and how you ended up bringing your mom here.
My mother, she widowed about 9 years ago, and she was very independent. But we have a terrible hurricane, Maria, in 2017. At that time, I had to bring her here to Phoenix because she couldn't take care of herself, but also she needed to have her medical care. And when I moved to Village Medical, I have a good friend, colleague of mine, Dr. Berkowitz, and he became her primary care doctor. And since then, she's been, visiting him like every 3 or 4 months, and she's extremely happy with the care that Village Medical is providing. I learned about grieving in the most beautiful way when my grandfather passed away, my father's father. And the way my dad conducted himself through illness, it was the most beautiful experience that I saw about grieving. And then decades later, when her father passed away from cancer, how she took care of him at his home in conjunction with her brothers and sisters. It's an experience that I never forget, about caring with love. She gave back what they gave her when she was a child. Then came the moment that my dad passed away from cancer 9 years ago. And I saw how she took care of him. And then also I had the chance to take care of him. I remember the last time that I walked into the shower to bathe him, and we did it with so much fun and everything. And then I had to do it, but in his bed. And it was something so simple to do that it helps you be compassionate and give with love. And it helps me as a physician, because when I see my patients, especially the elderly, it is so cute when they come all dressed up with makeup.
It's a visit for them, right? They're getting outside and they're coming to see you.
They're dressing for me, and I was like, I would say, my princess, how are you today?
Yeah.
For the guys, like, a big shake of the hand, and it's to know them, because even though we're hurting, we're not suffering.
Right.
It's about honor and grace.
So it sounds like that's something that permeates your whole family.
Absolutely.
So 2 quick questions to close it out. First one, what's your favorite food?
Oh, That
I'm Italian, so pizza would be fine.
I was gonna say lasagna a little bit.
A little lasagna never hurt anybody.
Yes.
Second question. If you could say one thing to your dad, God rest his soul, if you could say one thing to him, what message would you want to send to him?
Thank you, because you set the base for a great legacy of service, to be warm to people, to share one's a willingness to share our blessing, to have a pleasant personality, that and many things. But he basically taught me well to be caring.
I love that.
For people.
That is so perfect. You were awesome.
Oh, thank you so much, sir. Appreciate it.
Well, good morning, Loki. I'm so pleased to be here in sunny Phoenix, Arizona. So thanks for having me in. So you and I had the opportunity to meet maybe 3 or 4 weeks ago when I came and visited you on your clinic for the great patient accolade that you got. So again, I want to congratulate you for that.
Thank you so much.
So talk a little bit about, not that patient specifically, but how you work with patients. How do you think about patients?
So I think working as a nurse practitioner is rewarding, and it is a long-term relationship with the patient. So working with patients is really great opportunity to help patients to save their lives and also to prevent certain disease conditions.
Do you think people appreciate their health when they come in? I was talking to Dr. Fields the other day, and we were talking about Medicare Advantage, and he said that the insurance companies put supplemental benefits in that the patients they don't value them, because he went on to say that no patient really thinks they're going to end up in the hospital, or they don't think they're going to need an oncologist. How do you experience that? Do you feel that same way when your patients are coming in?
Yes, most of the patients, when they express those kind of concerns, and they also express, do they really need that supplemental insurance? So I try to educate them and tell them based on their risk factors, comorbidity, they really need the supplemental, because Medicare doesn't cover most of the required medications,
Right.
which are very necessary for the patient.
Right.
And also suppose if I write some lab tests, which is to identify his risk factors and also to know his parameters about the medications.
So do you find that patients tend to be less compliant if the copays are high for prescriptions?
That's exactly true.
Yeah.
Yes. The cost is, when the cost is high, the patient cannot take the medications.
Right.
So that's the reason we try to provide cost-effective, high-quality, comprehensive care to patients. And also I try to prevent the disease conditions by doing the screening tests.
Yep.
And also through education. Education is the main part.
Yeah.
Like education towards the diet, exercise, and lifestyle changing activities.
So what caused you to say, I want to be a nurse practitioner? Why did you pursue this path?
Yes, from my childhood, I have a strong desire and to become a nurse. And I was motivated through my family members. So both of my aunts, they were nurses, and they became administrators later. And my dad, he was a nurse.
Really? So it runs in your family?
Yeah.
And do you have children?
Yes, I have kids, my daughter and son. And my son and daughter, they are currently working for a health insurance company.
Oh my God, are you kidding me?
Yes.
There's no nurses following in your footsteps?
No, my son going to be a doctor. He got admission into medical school.
Congratulations.
Thank you.
If there is one person on earth you could meet, who would that be and why?
My mom, because she gave me birth, and also she taught me how to live in a society, how to respect people. So respecting human beings is very important. And also, I want to treat patients the way I want to be treated.
Thank you for your time this morning,
My
Loki.
pleasure.
Really appreciate it.
My pleasure talking with you today.
Hi, Ann.
Hi.
What's the last 6-year path been like for you?
What is some of my journey here? So I started here in 2015. I came from executive search. I came right on the heels of our Series A funding, and we had just signed a big agreement in Indianapolis with community, and we had no people. And so
that might have been a small problem.
it's a little hurdle to start. So I came in to build recruiting, but really I was just recruiting for a while, like personally hands-on.
So like an individual contributor,
Correct.
because there was no team.
Correct, it was just me.
Yeah.
So I brought in some people, and Tim's first meeting with me said, what is your plan? And I said, I don't know. Not sure. Not a good first impression, but like, what do we need to accomplish? So then I'll tell you the plan. No, but we had success. I've told this story before, but my husband, Kurt, who you know, asked me after I had already started, like, are you going to be able to recruit people there? I'm like, that would have been a great question to ask on the front end. I don't know. But the reality was it was very easy to get people to buy into what we were trying to do. So I recruited for a while, maybe 6 months into my journey. You and Tim asked if I would run HR.
Yep.
So I built the HR function for several years, 4 or 5 years. And then a year ago, I moved over into provider growth with you, as you know.
Yeah. So before you go there, just describe when you started. I have to imagine your job is to recruit people. I would have probably hit the panic button, but by the time you made the transition, you built a team.
To me, the most important thing was there's a lot of compliance associated with HR that I knew nothing about. So we got a really good employment attorney, and I learned really quickly about some of the mechanics of that. So I built a really great team. So thankfully they knew what to do, and I really just had to lead.
But if you think about it, that team, who I think speaks with a voice of passion to the external world, to the community, a lot of people that I talk with credit you for the culture that was created early on in the company. How do you feel about that?
I think culture is jointly owned and created. So I think we spent time. Interestingly, one of my first meetings with Tim, once I got a plan together of what I was going to do here, I asked him, what are we looking for in a person? What are our values? And he, in true Tim fashion, was like, no, we're not doing that. And I was like, what? How are we going to know behaviorally, who are the types of people, remove technical abilities aside, how are we going to know? And he wasn't reacting to having values, he's reacting to what many organizations have, which is just something that lives on a wall or a tank card that is not lived and felt and all these things. And so we went through an intentional exercise to develop those values and the behaviors that underlie those values. And I really embraced those. We certainly incorporated them into our people practice when I was in that job. And,
So interestingly, when I think about what you built in the talent function, and then you turn your attention to provider development and growth, and I think about what's needed there. So when you got into that function, there wasn't one. So talk about that.
We had a team of good people who was doing a lot of things that were not the right things in light of how the business had evolved over time. And so it was getting those people supported by clearly defining for them what they needed to be focused on. So it was really hard to do that, but we did it and we made a ton of progress. We doubled the team in growth last year, and we're tracking much more closely to hitting our goals reliably, so it was positive.
So shifting gears for a minute, you mentioned Kurt. Talk a little bit about your family, especially over the last couple of years in a pandemic with a couple of small children.
So I have a 6 and an 8-year-old. My daughter Caroline is 6. In the last 2 years, though, it's been rough. Truly, I struggled in the pandemic, especially the first year of it. I'm an introvert, so like it wasn't necessarily missing all of like the externals, but like even to know that you can't have that connection if you want it is really challenging. And then trying to support 2 kids who at that time were younger, preschool and I think kindergarten my kids were, and help them try to navigate and understand with patience, which I don't have a lot of sometimes, was super hard. And they struggled a lot too. So that was really hard.
Last thought for you. I've been working professionally for over 40 years. And you are one of the most engaging, thoughtful professionals that I know. And all I wanted to say is thank you for being on the team and for building the team.
Thank you, Paul.
Thanks for listening in today, and I hope you found the conversation enjoyable. Please tell your friends and remember to listen in the future. Have a great day.